fallout from the murder of United Healthcare CEO includes a number of critics of the healthcare industry condoning or otherwise justifying the shooting. It's a response that reflects long simmering dissatisfaction with health insurance practices. And joining us now is former State Health Director Will Humble. He's the Executive Director of the Arizona Public Health Association. Will, always a pleasure. Good to have you here.
Thanks, Ted.
All right. As I mentioned, it puts a spotlight on the industry, specifically the contempt that so many people have for the industry. What's going on here?
Well, if you think about what the source of that contempt is, it's really people's lived experiences. Or families' lived experiences. And so if you think about, like, what's the most stressful time in a person's life? You know, there's events like having a kid and getting married and things, but then if you get a diagnosis and you think there's something that could be really wrong with you, and you want to get treatment, and your insurance company either doesn't authorize the kind of treatment that your doctor wants to give you, or later denies a claim and you get a big bill, and you know, you start forming these real visceral reactions because it's these denials, these claim denials, and not, you know, approving a certain medication for cancer or something. It happens at the most stressful time in your whole life.
And sometimes it happens as a surprise, and sometimes it's so complicated you don't even know what's happening.
Right, and that's right. And so many people have had so many bad experiences. By the way, they're doctors too. I mean, they're the ones who have to explain a lot of this stuff to their patients. They're not the ones denying the treatment or denying the claims. They're the ones who have to explain it to the patients. And so they have a real visceral reaction to what happened too. So there's reasons behind it.
Yeah, but does it surprise you the extent of what we're seeing out there in social media especially?
Yeah, I was kind of surprised.
Yeah.
Now, in retrospect, it kind of makes more sense, but I was surprised.
Yeah. All right. Let's do some basic stuff here. Why do health insurance companies exist?
Basically, it goes back to World War II. So prior to World War II, there was really not much health insurance. And by the way, there wasn't a whole lot of treatment for a whole lot of things anyway. There was some basic stuff. But as World War II was coming to an end, there was an inflection point in the U.S. And it was like, how are we going to... There was a movement, the labor movement, a lot of it, and companies wanting to attract workers. And so they began to offer health insurance, and there became this growing movement to try to get some sort of national program together, like they were doing in Europe. So after the war in Europe, during Reconstruction, they formed basically universal health care across most of the EU. In the U.S., it became an employer-based system. So so President Truman tried to get something close to a universal health care system in place, but the American Medical Association killed it, and it became this employer-based system to get health insurance from then on, really, basically to this day.
Were health insurance, correct me if I'm wrong here, but were most health insurance companies, were they nonprofits to begin with?
It's always been, I think, a mixture, at least in the last 30 years. But honestly, Ted, I think there's people who think there's this huge difference between a nonprofit and a for-profit health insurance company. I don't think there's a whole lot of difference. I mean, yes, they're shareholders with the private ones, and the shareholders want a return on their investment and so forth. But the nonprofits pay their executives a ton of money, and they have tons of middle management, and their bonuses are tied to the profitability. I know it's a nonprofit, but you're putting money in reserves. Your bonuses are tied to that, which incentivizes the claim denials and the not authorizing treatment.
So with all that in mind, when critics say that health insurance companies are an unnecessary middleman between patient and provider, do they have a point? Is that a little overreaching? What do you think?
Well, if you take our European democracies as your sort of the comparison cohort, you can look at, some of those countries have some kinds of health insurance, but in general, it's more of a universal Medicare type system, and they only spend between 9 and 12% of GDP, gross domestic product, for healthcare. In the U.S., it's over 16%. So by getting rid of that middleman over in Europe, it's not entirely gone, but they're able to spend a lot less on healthcare, and by the way, have better health outcomes and higher life expectancy, not just because of healthcare. There's other reasons. There's less obesity, they walk more, and that kind of stuff.
What goes into the decision by the health insurance company? in terms of paying for care or not paying for care?
Well, I mean, there's two things. They want to make sure if there's for profit, they want to have a return on investment for their shareholders. The CEO wants to make a good salary and get a good bonus. And so there's incentives within the system to not approve care. I'll just give you an example. If you have a certain kind of cancer, there's a old drug and a new drug, and you go in, you're most likely they're gonna approve you for the cheap drug and to say if that fails, we'll consider the next one. And so there's this incentive in the system to push care into the cheaper areas, and that by.
But Will, that sounds suboptimal. That doesn't sound right.
Well, they're getting there's better performance in Europe. Yeah, they have a completely different system, and they don't have these middlemen in place, but the interests are so entrenched here now. There's so many stakeholders with so much money at stake. I don't see it ever changing.
ACA, Medicare, where do they fit in all this?
ACA helped, the Affordable Care Act helped a lot. Because there were people who just, remember, before the Affordable Care Act, if you had a pre-existing condition, you couldn't even buy that insurance that's denying claims and so forth. So that stopped. And the other thing that happened is people were no longer handcuffed to their jobs. Because remember, before the Affordable Care Act, if you wanted to be an independent contractor to go out and do something on your own, you'd be like, I can't, I got to go work at an agency, I need health insurance. Now you can buy a marketplace plan. So the patient portability of the ACA, I think, is as important as the being able to get insurance part.
But when you buy the marketplace plan, are you still the target there for suboptimal treatment?
Sure. Of course you go. Yeah.
Okay. All right. That's great. All right. Why this whole thing? I mean, you talk about health insurance to people, and the eyes will glaze over immediately. Yeah. Is it purposely so complicated? Why is it so complicated?
I think a lot of it is that so many of the decisions are so not transparent. Like, you don't know why. Why am I not authorized for this treatment? You don't know why, and you can't find out why. Why was my claim denied? And you try and you call, and you can't get an answer. So there's this mystery behind. It's almost like the Wizard of Oz. Like, who's making the decisions? I can't find someone who's making these decisions, and there's nothing more frustrating than not knowing who's making the decisions that's making your life more difficult.
So if you're denied a payment or if your treatment isn't authorized, what do you do? Where do you go?
I'm doing a blog on that this week, actually, because of what happened here. In Arizona, you've got the Arizona Department of Insurance where you can file a complaint. How much that will do for you is questionable. But before you do that, is be the squeaky wheel, basically, and call the insurance company, get people on the phone, ask the questions. Why was the claim denied? I want an answer now. If there's an omission if there's some signature that's missing, what is that signature? And just be tenacious. I think it's just being a squeaky wheel at first, and if it still goes on and you still either can't get something authorized or you later get a huge bill that you thought was in network and isn't, then just continue to be that squeaky wheel. And then finally, if you can file a complaint with the Department of Financial Institutions and Insurance at the state level. Arizona sadly does not participate in a national program where people can complain about other health insurance, private health insurance and so forth. We could under the Affordable Care Act, but legislature would need to authorize that and so forth.
But everything you mentioned, you got to do that. Be tenacious, be the squeaky wheel, and you're not feeling all that well.
It happens. All these things are a lot of times happening at probably the most stressful time in your whole life or your loved one's life. And so that makes it that more intense right there.
All right, Will Humble, great information, good conversation. Thanks for being here.
All right, stay healthy.